Great,
well,
you'll do great.
That, so it should be
You'll get the extra time.
I find it so much harder to be short than long. I just naturally ramble.
I'll rein you in. Don't worry. Don't worry. Good morning, everyone. Good morning. We've got a small group, so come on down and pitch in and enough to do the job. And with increased globalization and imports, are things changing with our food supply? Should we be worried, more cautious, and to what degree? Well, here we go again with three of the very best. Dr. Julie Gerberding is the former director of the Centers for Disease Control and Prevention, and she'll give us opening remarks on the nature and scope of foodborne illnesses. First, Dr. Gerberding.
Well, good morning, and thank you. I'm just looking around the room here, and I'm doing some math in my head, and I realize that you should look at the person sitting next to you, because one of the three of you will probably get a foodborne illness this year. About 76 million Americans get a foodborne illness every year. About 300,000 people a year get hospitalized because of their foodborne illness, and about 5,000 people die. So although we have one of the best, if not the best, food system in the world and the safest food system in the world, it still is a very important force of morbidity and mortality and cost in our system. And I think there are many things that we can do to help that system be as safe as possible. I'm using the term system for a very important reason, because the global food system is probably one of the most complex systems that we encounter. If you think about the global origin of foods, how probably even at this meeting we're eating foods that have been imported from various countries, various marketplaces, various sources, really a wonderful opportunity to enjoy the cuisine of our neighbors around the world, but at the same time a very difficult system to try to regulate, account for, and contain from the standpoint of infectious disease and safety threats. The other thing about the system, it's not just a human system. Of course, it's a human, animal, water, soil, ecological system. And all of those factors are relevant inputs into the system. The processes within the system really have to be thought of in aggregate from the farm to the table, because everything has to go right through that entire process for the foods to end up on the table in a format that's safe as possible for people to eat. Of course, the final output of that system is good health, profit for the people who are in the business of food, and ultimately consumer satisfaction. And we don't really have reliable measures of those issues and their relationship to food across the board, but we do have some pretty important systems of surveillance that help us detect when processes in the system get out of whack. Most of those detection systems are managed by the CDC, and that's really their role in this global system, is to detect and investigate outbreaks of foodborne illness or to define the burden and the sources of food safety issues. And my commissioners sitting on either side of this will be able to tell you a whole lot more about the regulatory aspects of it. But it isn't really just about CDC and FDA. It's also about USDA. It's about the trucking industry. It's about the whole grocery store industry. It's about all the food services that we have across our nation and restaurants. It's about the schools and the school lunch program. It's a very, very complex set of players and actors that really have to operate in a whole greater than the sum of the parts manner to result in safe food. Now, fortunately, those 76 million people that get a foodborne illness each year don't get very sick, but some of them do. And the people who are most vulnerable to the severe consequences of food safety issues are children less than 5 years old. These are the people who are most likely to require hospitalization. These are the people most likely to develop the most feared complication of foodborne illness, the hemolytic uremic syndrome, which is associated with the E. coli that produces the toxin that initiates the cascade of this very morbid and often fatal disease. So a lot of attention is placed particularly on E. coli infections because they do cause the greatest fear and the greatest harm to the greatest number of our children. Fortunately, that's a relatively rare disease, but it also points out something that does require improvement and an important role for everyone here, and that is that we underdiagnose these conditions. We underdiagnose them because people don't seek medical attention when they have a diarrheal illness or a suspected food illness. We underdiagnose them because many of our health plans don't routinely pay for the cost of a stool culture. It's not included because guidelines don't necessarily say an adult with diarrhea should get a stool culture, so there's not a reimbursement. And it really takes an astute clinician or a consumer advocate to really look for that diagnosis when you are sick. It's probably why we diagnose more in kids. A, they get more, but B, they're more likely to get tested because parents are worried and advocate for a more detailed diagnosis on the part of children. And finally, the systems that allow us to figure out when a food safety problem has arisen have only recently been nationalized and then globalized. So in the old days, if you went to the church picnic and had the rotten potato salad and all the church members got sick, it was pretty easy to tell the potato salad was a problem. But now, if you've got a case in Colorado and a case in New Mexico and a case in New York because it happened on an airplane and people are completely dispersed, you have to rely on the new tools. Fortunately, now we have new fingerprinting tools that allow us to match up the bacteria fingerprint or the virus fingerprint from people in disparate locations and link them together through computers at CDC. So if we get a matched fingerprint from Colorado and New York, we know that doesn't happen by chance alone. And we begin very early to suspect that there's a common source, and that starts the whole process of investigation much faster. Although you've been hearing a lot about more foodborne illnesses, some of that has to do with we're actually getting better at detecting them. And one of the best performance measures is how long from the first case to the point where the FDA gets the product off the shelf. And that time frame actually has been getting shorter and shorter for the last decade or so. So we are making progress. But as we get better at detection, you're going to hear about more foodborne illnesses. And so there's a little bit of a paradox in the system. So I'll just end by saying food is safe. I eat oysters. I've also had lots of foodborne illnesses in my travel around the world, and I think it's important for us to think of it as a system, and everyone can do their part to make the food supply as safe as possible.
Thank you. Dr. Hamburg?
All right. Well, as Julie was so eloquently describing, food safety is a large and serious problem, and it also represents a complex challenge to those in various sectors of society who are responsible for trying to assure safety, and individuals that are trying to protect the safety of the food they eat and feed their families. It also is very important to the economy overall. President Obama has made food safety a very high priority from his earliest days in office. This is manifested in a number of ways, including a historic increase in the budget of the Food and Drug Administration to address food safety problems, for which I'm very grateful, and also in trying to pull together the disparate elements of the federal government who have responsibilities for food safety. There are some 15 agencies or so that have a role to play, with FDA and agriculture, the USDA, being the main players, and FDA is, in fact, the dominant player in terms of we regulate about 80% of the food supply. Let me just say a little bit about what are some of the core elements that should be in a food safety strategy and really reflect the direction that FDA and the Obama administration are moving as we really look at food safety in this country and how we can strengthen it. First, as Julie indicated, and the title of this program underscores, food safety is a farm-to-fork system, and it really has to be treated as a system-wide problem. I think in the last century we tended to focus more on it as a sanitation problem in production plants and in terms of chemical contaminants and food additives. But when you focus on microbial contamination of food, you really understand that it can happen anywhere in the system from farm to fork, and everyone has a role to play. We need to focus on prevention and a risk-based strategy for food safety. We have historically waited till outbreaks occur and sort of lurched from crisis to crisis after problems are already entrenched and people are sick or at risk. But there are things that we clearly understand about high-risk foods and high-risk settings and the points in the life cycle of a food product where they're particularly vulnerable. And we need to put in place the preventive controls and the risk-based strategies to really turn the system into one that will promote healthy food rather than responding to problems. And I think it's important to recognize that the primary duty for prevention actually falls on the food industry. The government doesn't produce or make food, and they can't make it safe. What they can do is support the food industry to put in place the kinds of risk-based strategies and preventive measures in terms of assuring the safety of the raw materials from which products are made, the procedures they use for manufacture, how they transport and store food products, and testing of finished products and facilities in which foods are handled. So clearly FDA has a very important role in supporting industry in this regard and setting and enforcing standards that make the food industry accountable for prevention. And we have to ensure compliance through inspection and enforcement activities. It's also important in the modern era that we leverage available science and technology so that we can do a better job, so we can use on-site microbial testing, for example, in a much more timely way to understand risks and address them. We can do smarter inspections, so to speak, hopefully more efficient and ultimately, hopefully, cheaper and certainly more effective. We also have to expand our focus on recovery as well as response, because we've seen many instances where one bad actor in an industry actually undermines the whole industry. People feel they can't eat peanut butter because there's been a contamination at one plant. So we need to think about how we can both target our enforcement activities and also help the overall industry to recover when there's been an incident, so that there isn't this sort of tarring everyone with one brush. And we do need to strengthen FDA's tools in order to do our job. There's legislation that's currently pending that will give us some new authorities that will really be essential in this regard. Mandatory recall, for example, the ability to access certain records from food producers, the ability to actually track and trace food products as they go through these complex systems of production that we have now, working in partnership with CDC. The more we can really target what is the contaminated food, the more quickly we can respond, the lives that will be saved and the illness prevented, and the damage to the industry can all be reduced. And we have to expand our global footprint, as Julie said. It's a global world, and food is moving all over. And we have to create an integrated system within our own country, working with states and localities and the federal government, so that we can have a truly integrated system with a focus on prevention and a focus on accountability.
Thank you, Peggy. Dr. Kessler?
Well, it's a real to be here with Dr. Gerberding, Dr. Hamburg, and I think what you've seen, Julie, I mean, over the contribution to a safer food supply, CDC's efforts with PulseNet, greater detection, earlier detection, the epidemiology has improved just incredibly over the last several years. I mean, and a lot to your credit. And, Commissioner Hamburg's, just in how many weeks has it been?
5 or 6.
5 weeks.
Who's counting?
But your testimony in front of Energy and Commerce several weeks ago on food safety probably was as important as anything the agency has done in this area, because that's what it's going to take, as Peggy said, moving to a system of preventive controls rather than just FDA going in, chasing the horse after it's out of the barn. The problem, I mean, understand how daunting it is, and I'm glad you're there, but I don't envy you, because It is the purveyor of the product who has responsibility, not FDA, to assure the safety. And the fact is, when you put in a system of preventive controls and you say, okay, you're the grower, you're the distributor, you have responsibility, and you realize where our food is coming from, and it's coming from many parts of the world that have no sense of what a regulatory environment or culture or responsibility is, that's where it becomes a daunting set of challenges. But as I sit here, what strikes me, what's most interesting, Julie, you said 1 in 3 of us will become sick. Each year, what was it?
76 million people.
Right, will become sick from a foodborne illness, right? And you said the most extreme case is HUS, right? But look how we talk about food safety, and look historically. Back, in the Upton Sinclair days, it was sanitation. In the 50s, it was carcinogens. In the 60s and 70s, it was pesticides. Currently, I assume you're referring to microbial illness. And yet, we sit here, and the question is how we think about food safety and what is safe food supply. The fact is, many of us will get sick from food, right? Well beyond microbial pathogens. And in fact, perhaps the greatest challenge, and you know where I'm going, right? I mean, it's not HUS, right?
What is HUS?
Hemolytic uremic syndrome. We have, how many cases of HUS are there in the country?
Well, in the FoodNet system, there were 86 cases in 2007, but that's not, so if you multiply that roughly by 3, it's probably 300 cases, something like that.
Of HUS?
Yeah.
Now, if I asked you diabetes and a heart disease and stroke, that is foodborne. And so the question is, as we think, and the effort, right? Which is heroic on food safety, how do we engage? How does the federal government get its hand around even the bigger challenge that is emanating from food, and that is the diabetes, cardiovascular disease, stroke that is associated with obesity? Because there's no question, we can spend a lot of time, but if you recognize that fat, sugar, and salt, the business plan of the modern American food company is to take fat, sugar, and salt, put it on every corner, make it available 24/7, make it socially acceptable to eat any time, make it into entertainment. And the result is the conditioning in the brains of our kids and ourselves are becoming conditioned and driven, our behavior, to respond to those food cues. Right? That is a much greater and bigger issue with regard to the safety of food, certainly as it impacts our health. And in some ways, food microbiological hazard, we can get our hands around it, right? Because you can create an environment, right, and put in controls. How do you create the environment? How do you change the environment? The bigger question of if our brains are being excessively activated by fat, sugar, and salt, and that's what's going on, and that's leading to even greater disease and morbidity and mortality. How do we begin to think about what the roles are for CDC and FDA?
I'm intrigued by your reference to food as entertainment, that we've kind of transitioned, moved, developed into that as a social norm.
So social norms have, and I didn't understand this, how social norms affect our behavior. Let me give you the analogy. And we've got to be careful with the comparisons and the differences. But let me explain, understand how tobacco, what really happened. Nicotine is a moderately reinforcing chemical. Add to the nicotine the smoke, the throat scratch, the cellophane crinkling of the pack, the color of the pack, the imagery that was created 30, 40, 50 years ago of the cowboy, the sexiness, you'll want it, it's cool to smoke. What did we end up with? We took a reinforcing chemical and we made it into a highly addictive product. Right? I give you a package of sugar and say, go have a good time. And you're going to say, what are you talking about? Now I take that sugar and I add fat to it. I add texture. I add temperature. I add color. I put it on every corner.
I make it socially acceptable to eat any time. I make it into entertainment. I add the emotional gloss of advertising. You'll love it. You'll want it. You'll do it with your friends. Right? What did you think was going to happen? Right? I mean, that's what we have done in this country. So we have added the entertainment, the emotional gloss. Understand that social norms, how we perceive the product. Right? Is that my friend? Is that something I want? Or is that something that's my enemy and that's something I don't want? So, I mean, that will result in whether my amygdala gets activated or not. I never understood. So social norms, how we react to what's in our environment, I mean, is key. And certainly we have made food into something that's not only a positive reinforcing at its molecular basis, but it also is entertainment, and that only amplifies the reward value.
How would you address that, to change that, to shift it, if indeed that would be an objective?
Not the, again, we could spend, I don't want to, we could spend a lot of time on that. What it's going to take, I mean, how did we succeed so far with tobacco? What's the success? We used to view tobacco as positively valenced, right? What did we really do? And I didn't get this. Mike Perchuk, we talked earlier, the head of the Federal Trade Commission, 1990, sits me down for breakfast. I mentioned the obesity, the childhood obesity, and he said, our job, and I had just been in your job for a couple of weeks, our job is to demonize the tobacco industry. I went, what are you talking about? That's not the job of a federal official, to demonize an industry. But what Mike understood was what was necessary. We don't like to use that word, and don't think, an industry, that's not the right way to think. But what he understood was we had to change the valence on how the country views the product. Now, tobacco's easy because we can live without it, and we can do without it. How are we going to change how we view food? And what is it that we're going to, get to the point where we cool down the stimulus? And it does. I mean, if I go on every corner, there's that fat, sugar, and salt. I mean, if Starbucks has figured out how it gets me in there at 4 o'clock, it's added that emotional gloss, right? I have to change how I view the product. And that's going to require the entire country to change how we view food. And I think, as I said earlier, I think there is a need. I mean, it's really the problem is, what is it? It's about big food. It's about eating 24/7. It's about fat, sugar, and salt being loaded in all food. So, I mean, I think the campaigns have to be against big food, and I don't mean just in corporate. I'm talking about the size of portions. It has to be what's in the food, and it has to be this notion that eating, any time of day and breaking down those barriers. We have kids who have never been hungry in their lives.
Is that bad?
Kids that are eating 24/7, who are eating constantly through the day. I went into the food court at Union Station. We're filming a piece, and I will tell you, it's a food carnival, and the kids, a significant number of the kids, are wider than they are tall. Right? And I don't have to tell you, I mean, Julie can give you the diabetes numbers, right? They make the food safety numbers look like, right? Just a drop in the bucket. I think the answer is it is bad.
Yeah, but you said for a child, there are children who have never been hungry.
Throughout the day. They have never since, they just eat constantly throughout the day. They're eating food.
Well, and probably aren't responding to signals.
That's correct.
Yes.
That's what I meant.
Yes.
That's what I meant.
Okay.
I'm sorry.
Okay, no, that's okay. We're going to open up to questions. I have one last thing I want to ask. In a democracy, is it the government's role properly to manipulate, even for the public good, social mores, values, and habits?
So that, I assume you're asking the...
I'm asking anybody and everybody.
Well, I believe in the concept of paternalistic libertarianism or libertarian paternalism, having just come from a public health agency that takes that very seriously. And I love the book Nudge, because I think that's exactly what we're talking
Yes,
about
yes.
as a first step, to create the context, the environmental context where people are more likely to make better choices. So you're not saying you can't go to McDonald's, but you're not putting McDonald's in the school cafeteria. Or if you're running a corporate lunchroom, you don't put the Cinnabons at the front door, you put the fruits and vegetables there, or you charge a whole lot more for the Cinnabon than you do for the apple. And I think there are ways that people can influence choices by taking advantage of the environment that don't have to deal with the FDA passing a rule that says you can't have Cinnabon on the street corners of New York. So there are a variety of approaches in there that don't have to be completely regulatory, completely heavy-handed. This week I have an editorial in Annals in response to New York's trans fat ban in restaurants, which I thought was a phenomenal example of public health leadership, probably mayoral leadership as well. And that was the question I asked. Should the federal government now step in and say, okay, no trans fats in restaurants anywhere? And for a number of reasons, I concluded that for right now the answer is probably no, because we do need to learn whether or not taking them out of restaurants actually does result in a true health benefit, even though the logic model says it should. But also, in America, we consume 9 billion tons of trans fats every year in North America. And the supply chain of healthier fats can't support that yet, although it's getting there. So before we can ban them, we have to have some kind of alternatives for substituting in the foods that we do need to eat in restaurants. So I'd be interested what you would say to the trans fat issue.
Well, to the trans fat issue, is one issue and is part of a broader issue about what do people understand about the food they're eating and what opportunities do they have to control access to certain foods. With the trans fat, I think that the concern about substituting with more dangerous fats is a real one, but I think the New York experience shows that hasn't been the case. I think the New York experience has shown that it takes more than simply working with industry at times to change a system. And one of the things that's striking to me is that you need multiple levers to move an issue, whether it be tobacco or trans fat. In the case of New York, there was an initial effort to get the restaurants to sign on and to communicate the concerns and to look at alternative strategies to replace trans fats with other healthier fats. And there was some receptiveness, but behavior didn't change until there were actual requirements through a change in the health code to modify the use of trans fats in the city restaurants, the chain restaurants. Whether the issues of the larger supply chain, if the whole nation and the whole world moved in this direction, I'm not familiar with that issue, and it's obviously a concern, but I guess I would rely on the resourcefulness of industry to find strategies when they need to, and the appreciation that many of these changes require phase-in. But I'm also concerned about how we can make some of this more transparent. I think that one of the experiences in New York and other places when there were requirements for calorie and nutritional content posting on certain products, people were stunned by the levels of fat and sugar and sodium in products that they didn't perceive. I mean, everyone knows that McDonald's French fries are probably going to be high fat, high salt. But, people thought, that certain coffee drinks with a little bit of added flavoring, were probably, not too bad. And then, several hundred calories later and lots of sugar and fat. So I think there is a value in trying to make some of this more transparent to consumers, trying to communicate more clearly both in products you purchase on the shelf and what you can access in restaurants. The challenge of consumer education is a huge one, and I'm optimistic that there are opportunities to work with industry, because I think they're very responsive to what consumers want, and that as there have been shifts in consumer preferences, we have seen some shifts in how manufacturers are positioning products. I think we have to keep pushing to make sure that when people say, that a product is low fat, that it really is low fat.
Kessler?
Once you recognize that by putting fat, sugar, and salt on every corner, it available 24/7, is affecting the learning, motivational, habit, and memory circuits, really resulting in condition, we're setting up our kids and wiring those circuits so they develop conditioned and driven behavior for a lifetime. Right? That has profound policy implications. Of course, it's not just us. You can argue adults can make free choices, but when you're dealing with kids and you're setting up that neural circuitry for a lifetime, that gives, I think, a greater role for policymakers to try, and a responsibility to try to intervene. But it also is, just you asked, in a democracy and in our Constitution, we've always viewed, information and speech, company could go do anything it wants. That's fair for neutral information and political, information. Once you understand that some of that information is in essence those cues that are activating the brain circuits, I think over the next 20 years, FDA is going to find itself just with tobacco. I mean, you now can regulate tobacco advertising you want, consistent with the First Amendment. That's a profound set of regulatory tools. I mean, in 20 years, we can have nothing, literally brown paper wrappers with no imagery, right? And that's where you could get to over the next 10, 20 years. The question is that permissible under the First Amendment?
Right.
The First Amendment says it protects speech. So if that pack and that image is just viewed as neutral speech, you can't regulate it, because that's protected by the First Amendment. If you realize that pack, right, and that imagery activates the neural circuitry and it serves as a cue and causes arousal and increased focus, then it's not neutral information. So I think we're going to find over the next 20 years a very interesting debate as we understand more about what drives consumption, what activates the brain, and does that give you the ability, give FDA the ability to take greater action? I think when you're talking about activating the brains of our kids, right, that is generally one role where paternalism is more accepted than in other areas.
Questions, please.
Go back to foodborne illness. Oh, thank you. I'm wondering about whether or not the perception, and this is perhaps driven by the media, as says a person from the media, I'm wondering if there's actually an increase in incidence of related outbreaks. And if not, I'm wondering what your perceptions are about our tolerance for risk, whether our tolerance for risk as a society has become perhaps scientifically untenable, given that these are living organisms that we're ingesting.
The surveillance systems that the CDC has in place have tried to understand trends over time in both outbreaks but also sort of the endemic level of foodborne illness. The most recent data are from 2007, at least the publicly available data. And since the early 90s, there has been an overall reduction in the incidence of many bacterial enteric infectious diseases until about 4 years ago, and it's been plateaued for the last 4 years. And a specific organism, something called crocus, which is the parasitic cause of disease, has increased. So there are some signs of progress. Mostly the early signs were linked to the changes in the beef industry, and then linked to, more recently, in salmonella infections, changes in the chicken industry and the heightened USDA requirements for salmonella control in chickens. But even with that, I think the last year, 2008, the number of broilers that have salmonella in them when you probably pick them out of the grocery store is about 8%. So, food is not sterile, and the ability to really manage trends over time is part of the challenge. And I think it goes back to what the Commissioner said about the importance of not relying on case detection as the barometer of how we're doing. We really need to be putting in the preventive measures that act far further in the chain of evidence. One of the things that is definitely changing is what foods are the culprit. And we are certainly seeing more produce as the sources of recognized outbreaks. And that's not surprising because we're telling everybody to eat more fruits and produce. And so the paradox of wanting to do that is the fact that there is more of a risk with things that aren't coming to you sterile and that are difficult to decontaminate, so that there is more foodborne illness associated with leafy green vegetables, green onions, lettuces, and so forth. And that's just, that's part of the challenge that we face. There's a yin and a yang.
First of all, David, thank you. You were much kinder today than you were this morning in the obesity session. My name is Deborah Demuth, and I'm from McDonald's. And the reason I'm here is because we care, all right? Seriously. McDonald's wants to be a part of the solution. And they've been saying that. They've been struggling with how to do that. And it's not just McDonald's that needs to be a part of the solution. Obviously, it's the whole food industry. And I'm a nutrition scientist, in fact, lipid biochemist. I can talk to you all day about trends. But we as nutritionists in the industry have to influence our industries as well, and also represent our industries to you in these kinds of environments. And I have really two questions for you. One, as the food policy increases and trans fats are banned in New York City, the sodium restrictions, which is the next initiative up, what kind of monitoring systems are you going to put in place to see what the real benefits are to the population? Are you going to monitor various biomarkers to see if there really is the improvement that we're projecting based on public health data? I know that that New York City is planning on addressing or looking for any unintended consequences, but it's limited. The data that's going to be collected is going to be somewhat limited. That's my first question. The second question has to do with how can industry help. This morning, Jay Schuyler talked about McDonald's years ago. In 2004, one of our suppliers took milk, put it in a little white jug, took it to school, gave it to the kids instead of those little ugly cartons, and the consumption in the school of milk increased 35%. We put a licensed character on it in our system in McDonald's. It doubled. The consumption of milk doubled in Happy Meals. So there are things that industry can do that helps. When we in Happy Meal apple dippers, it's a half a serving of fruit. Overnight, we became the largest purchaser of apples in the U.S. With trans fat, one of the reasons, and I'm not saying industry handled it perfectly, okay? But one of the reasons it took so long to get trans fat out of the oil supply in the U.S. is that when we went to look for the oils, not only was there not enough oil of canola, for example, because you want to have a healthy oil blend when you do substitute change blends, there weren't enough canola seeds to plant to get the oils. So supply chain is an issue for us as well. And I'm proud to say that around the globe, McDonald's has removed trans fats from their oils. It's not just in the U.S.
Let me interrupt you. What is your first question? Let's take one question at a time and just one question.
Okay. How will we know it helps?
How
are you going to monitor the health benefits? The health benefits in various communities or nationally.
Let's take that question.
There's two papers that were published this past week. One is about food labeling and one is about trans fats. And there were two editorials, and both editorials basically said the same thing, that we do need to evaluate the benefit. And it's not impossible to do. You can't do a randomized controlled study, but there are various ways, and intermediary markers of improvement in cohorts of people would be one way of doing that. Another way would be doing some community-based evaluations, looking at before and after these kinds of things are implemented. And I hope they are planning to do some of that in the communities that are taking these efforts to the most extreme phase of implementation. The problem is that nobody is able to do it across the board except Denmark. And Denmark's a pretty small country, and they really implemented a number of controls at the borders to be even vigilant about chocolate candy that gets brought in when people are coming across the border. So in that country, there is definite evidence that they have better cardiovascular health, but so do some other Scandinavian countries that haven't taken the trans fats out of their food because of a whole lot of other lifestyle-associated reasons. So it's very difficult to say overall right now what the scientific evidence is, and that was part of the reason why I think both of the people commenting on these experiences said that it's premature to require this, but we need to study the effects because there likely will be health benefits. But until we know that for sure, I think it's difficult to impose a regulatory or solely regulatory approach.
Please.
If you travel internationally, what should your kit bag include? Over-the-counter or prescription?
Well, the CDC Travelers website does advise you to carry Pepto-Bismol and anti-motility drugs. But when the CDC sends its own scientists to travel internationally, we travel with ciprofloxacin and Flagyl as well. But always the travel kit contains the rehydration salts. And I can't tell you how many times in my travels I've had to rely on those little foil packets of salt solution to rescue me from having to end up in the emergency room undergoing intravenous hydration. But I've traveled in some pretty primitive places. So the use of antibiotics is not something that is recommended by infectious disease experts, but infectious disease experts almost always travel with ciprofloxacin as well.
You'll be next. Go ahead, Nancy.
Peggy, this is for you. In your new and that wacky world you live in between the USDA and the FDA. You know, pepperoni pizzas may be under USDA and a cheese pizza may fall to you. How do you coordinate that kind of information sharing between two very large bureaucracies? And how do you keep it transparent to the American public?
Well, I'm still learning the territory, but I think that this is a recognized problem, and many of the boundaries are very clearly defined, and it's not an issue. But there are areas of overlap of responsibility, and it doesn't serve either agency well or the public well to have that persist. And that's part of what President Obama is going to try to achieve through the Food Safety Working Group, really sort of looking at the roles and how we can align things in the best possible way.
Do you see yourselves changing? Perhaps you take over more, USDA takes over things so that the lines become more distinct?
Well, I think that question is being examined, and I think that there will no doubt be some shifts, but I can't really speak to that right now. But it's a very important question, and the coordination is very important. And from my perspective, to be blunt, one of my concerns is resources, because in fact FDA is responsible for far and away the regulation of the majority of the food supply, yet we don't have equivalent resources.
But you've already taken some very big steps, in that regard. You appointed Mike Taylor as a senior advisor. Yes. Mike was at FDA, really deputy commissioner for policy, then went to run FSIS, and now back as your senior advisor.
Right.
You have Jerry Mann, who just got appointed as deputy undersecretary for food safety at Ag, who had been at FDA, now at Ag. So you had a tradition at Ag, right? You had a tradition that FDA was a public health agency. Ag was, responsible for, the well-being of the American, farming community.
Right.
And that has shifted, right? So that increasingly you have colleagues and they're working interchangeably, and that's a big start.
Right. Right.
I hate to muddy the waters, but there's another agency that I think ought to be included in that conversation, and that's the EPA.
Yeah.
Because some of these foodborne illnesses are actually ecological illnesses. If the groundwater is contaminated with cow manure and you're spraying the groundwater on the crops as an irrigant, you are essentially contaminating all of the lettuce with E. coli. So, we have to really take a systems point of view, and the structure of how the federal agencies interact is probably far less important than how they network and really examine this as a systemic whole.
Hi, I'm Jan Hamilton in private practice here in Aspen in preventive nutrition. Started as a 4-H girl, and my question involves the manipulation of the food supply. And I'm seeing that now in lab tests, nutritionally, in my patients here in Aspen, and really relates back to what we saw happening in the beef industry, where the product was leaving our ranch in a very healthy form. And we know that a factory in England manipulated how the cattle were fed and resulting in mad cow disease and BSE. And I was in England at the time doing research. Concerned with the future as we look at how is the manipulation of and the reflection of what's in our water. We can equate the obesity epidemic, if we're really using a broad spectrum thinking pattern, perhaps back to the days of the birth control pill. Is there a hormonally manipulated water supply? We're not filtering the water supply for hormones. Would there be a component? I guess we've all heard it's in the water. Well, maybe it could be. Or maybe the manipulation of foods that we're not even aware of now would be impacting the future healthcare budget of America in a very intense way. Are there things in the environment that are creating the increased risk of cancer? And what agency is looking into the crystal ball, into the future? I'm able to do that through the lab tests that we're doing. We do a stool test, a blood test, with food and nutrition-related markers, biomarkers, which relates to my friend back from McDonald's. We're both in the food industry. We're very concerned about the health care of our nation and our grandchildren, and we trust you to help us out because you have the power to do that. And I thank you.
I think we can probably answer, because you do the food, CDC does the humans, and EPA does the waters. There are testing protocols in place. I think the number of chemicals that CDC tests every year through the National Health and Nutrition Survey mechanism is now up to 228 or some chemicals on a population basis, and they're looking at phthalates, which are part of what you're talking about as potential contaminants. They're looking at other organic and inorganic compounds that may be present in trace amounts in people, and just documenting the amounts of these trace chemicals in human tissues over time. The APA does similar kinds of environmental assessment I don't understand what their sampling protocols are, and I know that the food labs at the FDA have similar sets of responsibilities. The problem with all of that is that we have a heck of a time trying to link it to any particular health outcome. And so, if nothing's changing, it hasn't been a high priority for investment. But when we see compounds that do appear to be increasing in human tissues, those are the places to look first for health effects. And I think there is some important work going on, both at CDC as well as the National Institute for Environmental Health at the NIH, to try to correlate the presence of chemicals and the health status of the people at risk. One thing for sure is they're not uniformly distributed around the country, so there are hot spots, and those are obviously prime targets for looking first at
and
the issue.
I think the other thing to add to what was outlining in terms of the monitoring and the testing is just the recognition that we live in an increasingly complex world. The food supply is very different from the days when you bought food in your local community. I mean, there's some movement back to that, but there's these centralized processing, whether it's beef or other kinds of food products, and then distribution over wide areas. The interplay of environmental factors and exposures with other components of the food supply and systems that impact on health all are happening at the same time, and it's very hard to sort out some of these relationships. And I think being as responsible as possible in response to this complex world that we live in requires a very multidisciplinary approach. It requires research at all levels, in the laboratory, looking at very specific questions about what is the influence of this chemical when it interacts with this chemical, looking at on the other end of the spectrum of research, what do we know in populations, and can we find correlations between higher exposures of something and disease? And it's very hard research to do, but you need that spectrum of research. You need to ask good questions, and you need to have good science to try to answer them, and then you need to take the best possible science and apply it to policy making.
30 years ago, under the leadership of Chairman Perchuk that David mentioned, the Federal Trade Commission launched a proceeding that was colloquially known as KidVid, which was looking at advertising to children on television of food products of various kinds, mainly sugared cereals and all of that. It did not proceed for two reasons. One was the First Amendment issues that were raised by the commercial speech involved, and the other of hard data on the effects of sugar and other additives in the products in question. And I'm wondering if now that it appears the data, at least on the sugar side, is better, whether you see any possibility or need or interest in Washington for such a proceeding or a similar proceeding through another agency to be launched.
Well, there is legislation I know that's being discussed that is a follow-on to what you're describing. In fact, FDA doesn't have the lead role on controlling advertising. But I think David should really address the question of he's much closer to the data on what do we know scientifically about the influence of...
I think that David Vladeck has gone and become head of the Bureau of Consumer Protection. And there are, that is a very, very, very strong staff, who've been thinking about these issues for several decades now. And I think with David's leadership and with friends at FDA, they are clearly thinking about what is the right strategy for the federal government, and I think you're going to see a lot of activity. It's not going to be KidVid, Redux, but they are clearly going to, I think, try to make major inroads in this over the next several years.
There's a great resource, just so if you haven't seen it, that the AMA put together. I think they launched it in August before their president passed away. It was one of the last things that he did, and he compiled all of the information about advertising on children's shows for high sugar foods and pulled together. It was a frightening monograph. It was, and some of the children's Saturday morning stations have voluntarily changed how they deal with their advertisements, but one of the most important ones refuses to take the steps. So there's an opportunity to pressure from a commercial perspective as well.
Understand how powerful that advertising is, right? Industry will downplay, say the data's not there, how powerful that is. But what you heard this morning, how powerful just the sticker of a character is it can increase the consumption of milk. Right? So those learned behaviors, those associations, right? The food industry, they may not have known the neuroscience over the last 30 years, but they know what to place where in the supermarket and what to associate with, and that all drives consumption. So when the candy is put next to the milk, right? Or things are placed, with certain things. That association in advertising amplifies the reward value. There's no question that advertising, that adding that emotional gloss, it's never about. McDonald's doesn't advertise, correct me if I'm wrong, about the nutritional value of its food.
It's on the package. But the advertising is not. The advertising adds, correct me if I'm wrong, and again, this is the goal of advertising, but let's all understand it. It's all to make that stimulus top of mind. Right? So when you're driving along, that advertising, you're going to get cued, and it adds the emotional gloss. There's a reason why the tagline is, you'll love it, you'll want it. It's not that you're going to be, it's more nutritious or, so advertising has a profound effect. And again, I think we're only beginning to understand, its real implications. Again, it's not the only thing, but that on, top, it's another key component.
We work very hard in having growing success with our work in the domestic food supply, and it is a more complicated.
Pull the mic up.
I know it's a more complicated world as well, but over the last few years, we've had the melamine issues with food products and herbal and vitamin products that come from China. And knowing a little bit about this, there's no on-the-ground supervision to speak of, given the vast number of suppliers that contribute to the products that we end up importing and ingesting here, many of which we don't even know they're from China. Brazil exports animal feed to us. Brazil uses carboxin as an extender in animal feed. We've outlawed carboxin in the United States for, 30 years. And yet the animals that we wouldn't feed carboxin to, the feed comes from Brazil to our animals, and we feed carboxin to them. So how do we deal with these international complexities? It's a pretty big question.
This is one of the things that keeps me up at night. The huge and growing number of food imports that come in from overseas, not to mention drug and medical device products as well that the FDA regulates, really does create a huge challenge, and I think requires a whole new way of FDA doing business, to be honest. With respect to food, I think that we have to address it on a number of levels. One is that we clearly need to get into more countries and have some on-the-ground presence. But the notion that we could ever inspect and oversee, there's at least 200,000 food producers, I understand, that import into the U.S., and it's probably many more. But what we critically have to do is partner with other regulatory agencies that have comparable standards and sort of share responsibility for overseeing the landscape of the global food production environment. And we have to invest, I think, in training and raising capacity for regulatory oversight of foods in those countries that have less mature regulatory systems. And so it's going to take a lot of work. It's going to take a very concerted effort to do each and every one of those elements of what I was just describing. On top of that, the challenge you mentioned of what we've seen in China of intentional economic adulteration of the food supply, done in some clever ways, I must say as well, adds an additional element of real concern. Again, we see it in the food supply. We also see it on the drug side in terms of counterfeit drugs, which is a very large and growing problem as well. So how we really move into the 21st century and operate in a globalized world is one of my very highest priorities. I welcome input from people that have been thinking about these issues and perhaps working in relevant domains, because I think we really need some new strategies, some new paradigms for how we do business, and it's going to require partnerships that are very different. And again, working with industry as well to take responsibility and putting in place these kind of risk-based preventive controls throughout the life cycle of the product, I think is going to be key, and having standards that are clearly articulated and understood and enforced are going to be key.
The concern, ask a major food manufacturer in this country, if they know the source of the vitamins and minerals that are going into their food. And the chances that you will not get a clear answer because they don't know. I mean, the days when the Roches of the world were manufacturing the vitamins and minerals and fortified has long changed. And tracing back where these chemicals are really being made and who's responsible for that chain, I mean, it's a daunting set of challenges. I asked a chef in one of our local restaurants the other night, I said, just tell me, when I look at a menu, how should I, what's an important question? What should I look for in a menu? And he said something that just struck me. I mean, here I just spent 7 years writing a book, and I used to, sit where Peggy's at. He said, the most important question, ask where the food comes from in the restaurant. And I thought in some ways that was a profound point. I mean, ask yourself, how many times have you asked, when you've walked into a restaurant?
Never.
Do you know where you've never asked
I've never
where the
asked.
food has come from?
No.
Is that because you don't want to know?
Maybe I don't, but I should. Yeah, good. I'm going to take your question, but I wanted to give the lady from McDonald's the opportunity if you had a response to Dr. Kessler's earlier point. If not, it's perfectly fine. I just wanted to give you the opportunity. Then you don't have a response. That's fine. Okay, good.
I'm
Great.
Adam Dranowski from the University of Washington. I have always thought that added sugars and added fats and trans fats and even soda have a very specific place in the American diet. Their purpose is not to make people addicted, as David so ably said in his best-selling book. The purpose is to make the diet cheap. And in fact, trans fat high diets are cheaper than the alternative. Diets high in sugar are cheaper. And having a cheap food supply allows wages to be kept low, and it prevents social unrest. So there are major economic reasons why Americans have the lowest cost food supply in the world. But as we look at what has been produced, we realize that the resulting foods are energy-rich but nutrient-poor. And they cannot compete with fresh fruits and vegetables. They cannot compete with real beef. And for that matter, they cannot compete with real French fries. But they are cheap. So our response is to fortify them, enrich them, fortify them, add calcium, add folate, add various things which they are lacking. So what keeps me up at night is this question. How long before the FDA approves vitamin A fortified sugar?
I don't know if that question needs a response, but I take your point.
Explored correlating point-of-sale data from food sales, Safeway, and so on, where they just maintain mountains of data, and they data mine it extensively to figure out what people want to buy, and then connect that to outcomes data from public health and sort of healthcare delivery, and self-reported data. So when somebody reports I'm nauseous or I have some sort of early detect these patterns, and then connect that to the supply chain you're trying to build, so you can be more proactive.
CDC has not directly done that, but there are actually some health plans where members, and I won't mention specific which plan, but a plan that I'm well aware of, where members can volunteer to have their point-of-sale purchases in the grocery store actually tracked on a per-consumer basis, and then their nutritional procurement can be managed as a health intervention as part of their health coaching process. So it is amazing what the grocery store knows about you, and you know that little card that you get a little discount. Well, they don't just give you that card because you shop there. They give you that card because they collect specific information about what you buy, and so they know an unbelievable amount about the purchasing habits, and certainly it is a wealth of information that could be mined. But linking that to health information is something that crosses some privacy boundaries that. So is it just privacy? Well, I'm not familiar with how the data are formatted and what would be involved in being able to use them from a public health perspective, but I think the privacy issue would be a major hurdle.
Dr. McMurray?
I consider it kind of being a bad hostess to ask questions, but I just wanted to ask this question. So David, your premise about advertising. We have a lot of advertising about diet foods as well. And those ads make me buy those diet foods, at least for a short amount of time. But they haven't necessarily made us. So is controlling the advertising really going to solve our nutrition problems?
So again, so please, I'm not saying advertising is the only component, okay? But let me give you what I think the difference is. If you start off with an inherently reinforcing product, and you have one of the great experts in that, in Adam, and we could debate later, but if you start off with a reinforcing product, right, whether it's sugar, fat, or salt, and you add to that, right, advertising, you're amplifying the reinforcing value. If you add advertising on top of nicotine, you're amplifying the positive valence of those reinforcers. So I think it's different. I think advertising something that's not inherently reinforcing. You want to go sell a car, right? It will have only so effect. If you advertise something that's reinforcing by the very nature of it. I mean, the receptors. I mean, in our aura sensory, how our brain responds to those. That I think has a special category. So I think over the next 20 years, where First Amendment law will go, is if you're advertising something that is biologically active, right, I think that's a special category. And I think that's true whether it's going to be nicotine, and I think it's true whether it's going to be sugar. Those things are inherently, organisms will work for those. Those are self-administered kinds of substances. Cars and other commodities are not. As maybe diet product.
Please go ahead.
Dr. Hamburg, the FDA came out in favor of the bill in Congress right now that would ban the non-therapeutic use of antibiotics in farm animals. Could you talk about why that is? What are the food safety implications or public health implications of using antibiotics in that way?
Well, just to clarify, we actually took no position on the bill, but we did, in testimony in relation to the bill, indicate that we thought that the non-therapeutic use of antibiotics for things like growth promotion was not judicious and not in the best interest of public health, and it was really because of the concern about antimicrobial resistance and the effects over time in terms of the supply of antimicrobials that we have to treat very important disease, both animal disease and human disease.
I'm Fran McGee. I live in Austin, Texas. And if you're in Austin and you go to Wink Restaurant, they have a list of all the purveyors for all the foods that are used in the restaurant, just to by the way. I was born in 1941 on a dairy and vegetable farm, and I was pretty healthy until the 1980s. I picked up your book a couple weeks ago, couldn't put it down, because it was a huge aha, because it was about in 1980 that I started to gain weight. And my weight got up to 230. I'm down to 175. And I have diabetes, of course. And it's been a very hard road. And part of the reason I'm here and go other places, including to Santa Vive in Mexico for health education and support, is to constantly reinforce myself to be motivated to keep on this path of assuming responsibility for my own health. And I was just so struck by your book. And it seemed to answer so many questions that I'd had about how I lost my health. And thank God for the information that we're now beginning to have access to, including yesterday I was able to download onto my iPhone the Lose It software, which allows me to start to track very conveniently everything that I put in my mouth. So I'm so thankful for the information that we're beginning to have on labels and books that people like you are writing.
Can you quickly express what you think you started doing in terms of your eating habits? Eating sugar?
And salt.
That's pretty easy.
First of all, we're not related, right? This was not a plug, right?
He's not
We haven't, have we met?
Not a plant.
No, so I mean, it's not. Understand. I started 7-8 years ago trying. As I said, I was watching Oprah. I was watching Oprah, and there was a woman on it, and I said, who said, I eat when my husband leaves, very well educated, very well spoken. I eat when my husband leaves for work in the morning. I eat before he comes home at night. I eat when I'm happy. I eat when I'm sad. I eat when I'm hungry. I eat when I'm not hungry. And then she said, and I don't like myself. So the question was, why was she doing what she didn't want to be doing? Well educated, smart. What was driving that woman? And I wanted to understand that question as a physician. I wanted to understand clinically what was going on, right? And what was the change. I mean, the fact is, we always had fat. My grandmother cooked with fat and sugar. Right? I mean, so we did have that, but we had it occasionally in dessert. We ate with structure. What did we do in this country? We've taken down all those boundaries. We've loaded and layered fat and sugar and salt into our food, I think, more. I would, Adam, I think it started to make food, standardized. I think it was then optimized to make food highly palatable, over time. But we really have taken down all the boundaries to eating. Why do the French, why do the Canadians? What's the advantage that they've had? They would never eat between meals. They would never eat in their cars. They want to eat at lecture. They want to bring foods and meetings. Their social norms kept the brakes on. Right? And what we did is, our social norm, our society changed dramatically, and as part of the business plans, ask them, take fat, sugar, and salt and put it on every corner and make it available and socially acceptable 24/7.
Are you familiar with that data?
I'm racking my brains. I was once in a very important oversight hearing in Congress, and I had prepared myself for every possible question. And the first question I received was, could I please explain the hermaphroditic fish in the Potomac River? And so I had to go back and learn a fair amount about estrogens and these issues. And I don't believe that I discovered any such data, but I can go back and check because I have it on file.
I know there are some studies in the literature, and I remember looking at them vis-a-vis my own choices for my own family, some years ago, and I wasn't struck that the data was compelling, although one can understand the concern. But I'm not familiar with.
But isn't it related to fat content, not necessarily estrogen content?
Well, certainly there's a relationship between fat content and menses, but there also is the concern about hormonal manipulation of dairy products and possible influence.
I was at Dr. Kessler's earlier session, and I read your book, and I love your book. My son actually saw you back in Massachusetts, and he said, Mom, it's exactly what you're talking about. It's exactly what you're talking about, the fat, the sugar, and the salt. And no offense to the McDonald's lady here, but, earlier, I remember going to McDonald's. And now, taboo for all fast food. I don't eat fast food. And I think what Dr. Kessler is saying is it's the media and it's the advertising that's messing up our culture. So it's the environment because, we're being told, and I think what it is with Americans, we're so busy that we don't have time to go home and eat something nutritious, whether it be organic food or fruits and vegetables. We want that quick stop into Wendy's, stop into Burger King, stop into McDonald's, and we're not getting the proper nutrition for our bodies. And what's really sad is being a parent and, having a child. I mean, you're concerned about your children, whether it's grandchildren, regular children, you know what I'm saying? And I think that that's the big thing, is the salt, the sugar, and the fat. And if we change our conditioning of how we're eating and what we're putting in our body, it affects everything. It affects whatever you put in your body affects your mind. And we can change the way our bodies are structured.
Ask Adam Drenat. You agree or you disagree? You've studied this more than anyone else. You studied this going back, your first set of papers in the 1980s, right?
And yes, there is a rewarding value. But at the same time, I would say that not everybody adopts a diet of fat, sugar, and salt. They do not. So these are pleasurable foods. These are low-cost foods. These are foods which are widely available. But everything else is also available to most people. But there are aspects of our food supply. There are a number of people who shop at drugstores. If you go to a drugstore and see their food shelves, every single food item on the shelf is going to be fat, sugar, and salt. So shop the perimeter, don't shop at a drugstore.
If you look at the epidemiology, I give you three characteristics. Right? Some of you will not have any idea what I'm talking about in the room. Right? One, hard to resist your favorite food. Loss of control in the face of highly palatable foods. Two, a lack of satiation, a lack of feeling full in the face of highly palatable foods. And three, a preoccupation of thinking about foods between meals or sometimes when you're eating. Actually, sitting there, I'm eating, and I'm thinking about what I'm going to eat next as I'm eating what I'm eating. Those three characteristics, loss of control in the face of highly palatable foods, lack of satiation, and a preoccupation thinking about foods. If you do the epidemiology of that, you find that 50% of obese individuals, 30% of overweight individuals, 20% of healthy weight individuals score very high on those three characteristics. Those three characteristics are evidence, you call it what you want, are evidence of a conditioned and driven behavior. And we now know there's a biological correlate of that behavior. If you extrapolate, that may not sound like a lot. And there's risks of extrapolation, so you've got to be careful. That's some 70 million Americans who have this conditioned and driven behavior and that are highly responsive to fat, sugar, and salt.
We have run out of time, but I want to give our nice lady who's here from McDonald's, and I don't want to put you on the spot, but I think it's very opportune and fortunate for us that you're here. Is there a way, given all that has been discussed here, that the fast food industry can be a part of the solution, given much of what's been discussed today? And again, I don't want to put you on the spot, but it's just very opportune that you're here.
Things. One, it's about the food, and the other is about how we can use our power to influence in a positive, healthy way. I mean, we feed 58 million people around the world a day. Our hamburgers, the basic hamburger has not changed since 1955. It's exactly the same size as it was in the same calories. But we've added on other bigger burgers with more sauce or cheese or whatever, because that's what people tell us that they want. When people find out that we're changing our food, they get really upset about it. And our clientele, we have segments of the population that frequent more than others, but the average number of times a person visits McDonald's is 3 times a month. So what we can do, I think, we've done a lot since 2000. We've put premium salads on the menu. We've fruit, vegetables, yogurt buffet, things like that. The lower calorie items are on the menu. But I think we can do more. But we need people to come in and purchase them because, frankly, we lose money on salads. People don't. It's not our highest sale item. It's on there because we know that people want it. So I think with our food we can be more innovative. I think we can take a look at our global core. I mean, I think we can take a look at our food, and I'll stop there, and see what we can do to improve our food as long as we don't lose our consumers. But the other thing that I would like to explore, and this is where I was asking for your help, is we can impact with advertising in a positive way. How can we do that? How can we be a part of the solution? As opposed to being, what most people, every slide presentation in anything about obesity, you will see them either McDonald's fry or the McDonald's M or whatever. We're not the cause of obesity, but we certainly want to be a part of the solution. So I'll just stop there.
Thank you very much. Any comments from the panel?
Let's eat.
Let's eat. Thank you.